Welcome back, everybody, to another episode of the Brass Tacks Business Podcast. Today, I have Dylan Beckner on the show. Thank you, Dylan, so much for coming on, and we really appreciate it.
Yeah, of course. I'm excited to be here.
Yes, yes, yes. So, Dylan Beckner is a licensed clinical social worker, certified in perinatal mental health. She is a certified perinatal mental health therapist, and she's founder of Beckner Counseling. Her practice consists of 4 licensed clinical social workers who provide mental health therapy for ages 7 and up for things exclusively like anxiety, depression, eating disorders, neurodivergence, OCD, trauma, and couples counseling. Some therapists at Dylan's practice are also able to provide EMDR, DBT, which we'll talk about later, and couples therapy through a Gottman lens. They are located in Leesburg, Virginia, and can provide services virtually across the state of Virginia and throughout various states in the U.S. where licensed. All right, Dylan, thank you so much again for coming on. And yeah, I think I'd just love to hear kind of more about you, your story, and how you kind of got into counseling.
Yeah, so let's see. How I first got into it was I had a really great social worker who was at my high school, and I will always say that she changed my life. I lost my dad when I was 17. And she was such a great support person for me going through all of that. And when I was trying to figure out what I wanted to do, I kept thinking about her and thought, okay, I would love to be that person for someone else, and then went into social work. So it's very close to me. She's like a mentor, and we're still very close to this day too, which is great. But I started out working with kids and then the military population, then got into the eating disorder space, working in higher levels of care, like a inpatient unit or partial hospitalization programs. And then in 2020, decided to start my own practice, and then it's just kind of grown from there.
What a perfect time to start a counseling business, huh?
Yeah, it was such a weird time because there was such a high need for it and just not enough therapists. So business-wise, it worked out really well, and I was happy to be another resource for people because it was a lot.
Awesome. And tell us a little bit about that, Dylan, in 2020. I mean, obviously, had you been planning for a while to kind of start your own practice, and then 2020 happened and it just so happened to coincide with COVID, or how was that experience opening a practice in 2020?
Yeah, it's so interesting because I had never imagined that I would own my own practice. Going into
Yeah.
social work, I was like, I'll work for someone else, like have my job, be able to go home at night, and that'll be it. And then being in the hospital setting and just some of the stuff that was going on there that I didn't really love, I decided, okay, I'm going to go and do this on my own. There's such a need for it that I think I could really make this work. And my husband is super supportive, so he was someone who really helped me to get it up off the ground and get running on it. So, and then of course, with it being 2020, like I said, the business aspect of it kind of worked in my favor. So
For
it's just
sure.
right time, right place, right time.
I was just talking to somebody the other day because I remember when I was in chiropractic school, you always are talking to classmates like, yeah, I want to have my own practice one day. And, obviously you're in school, you're learning as much as you can, and you're taking your board exams. And like once you pass and graduate, a lot of, I don't know what a lot of other docs, I didn't come from a, medical background, or my parents weren't chiropractors or anything. So you're just looking to like pay your student loans off. So
Yes.
like you're just looking for any job anywhere. And I had the same feeling. I was like, I kind of had it in the back of my head. I'd always said in school I wanted to start my own practice. But then when it actually happened, my wife Jasmine was a huge support, system there. And had it not been for her, who knows if I'd ever, got it up and running. But talk about more kind of what that was like. Obviously you said your husband was super supportive. And then, you've obviously got four therapists now. Kind of what was that transition like, opening in 2020 and now bringing on 4 more providers at your practice?
It's been wild because as much as I said I'm never going to have my own practice, I also said I will never have a group practice. And then now here we are. It's like the cliche never say never is something that I keep falling back on, but I've been so fortunate where I really feel like a lot of these situations have just kind of like fallen into place, and I haven't really had to do a whole lot to make them happen. And so it feels right whenever I've been able to grow, or even just with starting on my own. Social media has oddly been really good to me business wise. That was actually how I found the first therapist who joined me. Her name's Amy, and found her through Instagram. We had gone to the same master's program, saw that she was in the eating disorder space. I was pregnant with my first child at the time and wanted to come up with some sort of plan to have that passive income while I was out, because, of course, being your own boss, you don't have a maternity leave plan. So I brought her on, and she's incredible. She's very similar to me in the way that we approach things, as well as like how we're trained. And then from there, she knew of another therapist who was actually her supervisor at the time for licensing, and her name's Erica. And she joined me. And then Erica had another supervisor named Matthew, and he came and joined me as well. So it was like this very beautiful web of people that I've been able to have join my practice, and nice to, like, it just sort of happened on its own.
That's amazing. How do you feel, Dylan, you've grown from, starting by yourself to now having four providers? What changes have you seen in yourself or ways that you've, grown professionally or personally?
It's a really good question. I think my confidence has definitely increased, because there's a part of me that's like, holy crap, I can do this and it's working. And it's not just me, like there's other people involved too. And taking on some of those like leadership qualities too, because although they are all very skilled, they all know exactly what they're doing. It's nice to all still come together as a group, and for me to lead it and be like, this is what's going on at the practice. Here's what I'm thinking. I think this is what we're going to do, and like get some of their feedback, but kind of be in the driver's seat more with some of those things. And it's helped my like decision making. Yeah. The confidence, I think, is the biggest piece of all of it.
What piece of advice, if anyone's listening and they're looking to become a therapist or open their own practice, what would one piece of advice would you give to them?
I think I would say that it's really great to take risks. And I think another piece of advice too is that you have to spend money to make money. And that was something that took a little bit of time for me to understand. But when it's come to like trainings and, like I totally redid my website, and it was quite the investment, but I think it was one of the best things that I've ever done. Sometimes you just have to really put that investment in, and you'll see really great output. And honestly, it's a really great analogy for therapy too, and many other things,
Yeah.
health and wellness related, like investing in yourself creates a really great final product.
I'm always telling patients, like, your health is your biggest priority. You know, people always use the excuse, I don't have time for work, or, my kids, or I'm too busy with the kids. And I'm like, what? If you don't have your health, you're not going to have time for any of it. So,
And it's a lot of the times it's like that first thing that falls off that, people might like ditch it for a little bit if things are stressful, but it's like that one thing that's so important to keep around.
absolutely. Well, getting into more of kind of your clients and the different challenges you see, what are some, because I know you said you treat from ages 7 all the way up. So what are some of the challenges or the needs that, your clients come in with, and what are some of the things you've seen over the last, 5 years?
Yeah, anxiety and depression, I would say, have been pretty standard.
Yeah.
And sometimes you have like comorbid situations going on. So, of course, we see a lot of clients with eating disorders. And so, with that can come anxiety or depression, or sometimes both. Trauma, again, is another big one. And a lot of kids, whether they want to call it trauma or not, totally up to them. But just all of the COVID stuff that had gone on,
Yeah.
and being home and away from friends. And it's just been quite a challenge for people.
Yeah.
And then, yeah, Matthew works a lot with like the neurodivergence. And so I think that the like diagnosing around that has been on the rise, just understanding like what that really looks like for people and trying to get them the best supports. So I would say those have been some of the biggest things that we've seen: anxiety, depression, trauma, eating disorders.
Tell me more about neurodivergence. Can you kind of give me a definition of what that is, or what that looks like for clients coming in?
Yeah, so I think of it almost as like it's a different way of thinking. And sometimes it can like affect social skills. It's kind of the biggest way that neurodivergence, I think, affects people. But it can be executive functioning issues as well. So like getting homework done or completing tasks at work. And you just have to find some workarounds. It doesn't mean that there's anything like wrong with you or that someone's broken. It just means that you might have to get a little bit more creative in the way that you are approaching things. And so that's where Matthew is really great. He's been pretty open too about his own neurodivergence, and that's been able to like help him with his own clients because he has that relatability factor, and working with kids and adults to just sort of figure out what it is that they can change, what's in their control to help them be more successful in whatever it is that they're working on.
Okay. You've got a couple other things that you guys special in. You mentioned eating disorders, but then you have these therapies, EMDR. Tell us what EMDR stands for and how those can be effective tools for your clients.
Yeah, so EMDR is like such a long-winded name. It stands for eye movement desensitization and reprocessing therapy. And so it was developed in like the 1980s by a woman named Francine Shapiro. And what it does is it uses rapid eye movements to help process through stuck points. So EMDR is best known for treating trauma. I use it a lot for people who have survived like sexual assaults or even like car accidents, but it's also effective for other things too. So again, like stuck points. If someone has a negative thought that it's recurring, maybe they've tried traditional talk therapy and they feel like they've had some improvement, but there's just something that's still there. This can really help to push past that. But yeah, so it uses rapid eye movements, and it facilitates the same sort of processing in the brain that happens when someone is in the REM sleep cycle, which is when your eyes are like darting back and forth, and it's where you dream and process things that have happened throughout the day. So I usually explain it to people like, if you have a filing cabinet and it's like chock full of stuff and the papers are everywhere and you're opening the drawer and they're like going crazy, you try to close the drawer, it gets stuck. EMDR just really helps to like pat everything down and put it in these nice folders. Those thoughts, those memories, those things are still there, but you're just able to deal with them so much better. And what's really cool about EMDR too is like you have to go through it in order to be able to be a practitioner for it. So it's kind of nice being able to be like, oh, I did some EMDR too in order to be able to provide this to you. So there's some like lived experience there, which I think can be helpful in trying to explain it to people with like how the process works.
That's super cool. So does sleep affect how, like, say you have somebody who's got a trauma and they're just not sleeping at night and say they're not getting their REM sleep? Can EMDR affect their sleep or improve their sleep, or does it kind of correlate with the technique when you're treating patients with that kind of tool?
Right. Yeah. It can be, of course, different for every person, but sometimes people have deeper sleep as a result of it. Sometimes people's sleep is a little bit disturbed after they do it. But usually with sleep, it's not affected like greatly. It's typically like a
Okay.
day or two after the session, and then things even back out again. So same thing with like headaches, just because when you think about it, like your eyes are darting back and forth, and that can be a lot when your eyes are open because they're used to being closed when you're doing that. So
Hmm.
any of those like sort of side effect kind of things, headaches, sleep disturbances are usually more of just like a day or two later.
And then what about with your military demographic? Is that a big, for PTSD or the traumas that they've been through? Is EMDR super helpful for them as well?
Yeah, absolutely. It's usually if I get someone who comes to me, military or like government contracting and done tours overseas or anything, if they're wanting to work through any type of trauma, I always bring this up to them as an option. Of course, too, with that population, like males are a higher population that I would see with that. And traditional talk therapy can, I think, feel a little intimidating to some guys. So this is a nice way to like bridge that gap and have them still engage in therapy without feeling like they have to sit there and like spill their guts out to somebody that they don't really know. Because the beauty of EMDR is it's inside your brain. You give me some feedback. I kind of base what I say back to you off of the feedback and just keep going from there. But the brain is in control. And so that's kind of the nice part of it, where it's not like you're sitting down and talking for 45 minutes to an hour just about like, tell me how you feel.
Sure, sure. And then what about like, do you like, 'cause we have a neurology provider in my practice who does a lot of like exercises with the eyes. Is that incorporated in the technique or no?
Not really. It's really just kind
Okay,
of like following my fingers back and forth. Sometimes people have a light bar, so the light moves back and forth, and that's what you would follow. The whole thing with EMDR is it's about bilateral stimulation. So it's one side of the brain and the other side. So as long as it's
sure.
one side of the body and the other, that's all that matters. So like I have these things and they're pulsators. So if someone maybe they don't see very well, or the eye movements are just causing some discomfort, we can use pulsators, which vibrate back and forth. So it doesn't have to be an eye movement, it could be the vibration on either side of their body. Or people have used auditory. So if I do things virtually, sometimes I have people who want to use headphones and they'll hear a beep in either side,
Yeah.
and then it facilitates the same process. So it's nice because there is a little bit of flexibility with it, and you can accommodate things based off of someone's needs. Because again, if someone's like blind or isn't seeing well, like the eye movements just aren't going to work.
Right. So it really can, like any external stimulus, can kind of stimulate the. Do you see a lot of brain hemisphericity, or a lot of, super right brain people or left brain people that, don't have equal on both sides?
For sure. Like that logic side is a big one. And so trying to connect more of that like emotion mind with the logical side and rational side is kind of the goal of EMDR, is like, let's pay attention to both and bring them together so that we can really work through whatever this situation or this difficulty is. And it works really well for people who are a little bit more like rational, because it kind of forces you to really think about what it is that you're feeling in your body, or what emotions you are experiencing, again, without having to like talk through it or describe it in like such great detail.
Especially with men, like we're so horrible at trying to explain our emotions, or even, I'm just mad. Well, what's wrong? I'm mad. Like it's hard for guys to maybe get a little bit more detailed. Do you find that, like with women, are they a little bit more, or do they respond better to just the more verbal, like talk therapy, versus your guys might respond better to the EMDR?
Yeah, I think there are, of course, outliers on either
Yeah.
side. Some men really appreciate the talk therapy aspect, but I think there is something to being able to offer this and be like, it doesn't have to be what you think is you lying down on a couch and just telling me about your emotions and your feelings. It can look different from that when you come to see a therapist, and having EMDR as that option is great. Especially too, because like you're saying, well, I'm mad. And then when I like talk to them about the different emotion words that it could be, I'm like, well, maybe it's frustrated, or you're pissed off, or there's so many other words that you could use. And they're like, oh, yeah, I don't know, maybe I'm
Yeah.
not mad, maybe I'm just annoyed. Or so it's kind of cool to be able to like provide some of that education too. And it seems so basic, but like they don't teach this in school. So how are you going to know?
I remember my emotion wheel. I had a big wheel with all
Yes.
the different emotions. I was like, oh, I didn't even know I was just angry, but there's frustration, there's fear, there's all these different things. So, and then how about, can your clients that are doing this EMDR therapy, do they have things that they can do on their own at home, or is it pretty much all taking place in your office?
Yeah, so the actual like eye movement piece is taking place at the office, the processing part, because of course when you're dealing with trauma, you kind of want it to be in like that safe environment in case something comes up, and I'm able to help people bring people back down. But when it comes to being at home, we always go over a range of different coping skills for them to practice at home. And I try to have people be on a good routine of practicing all of those things even before starting EMDR, because it's intense. And
Yeah.
I warn people and I let them know like this is going to be pretty tough at some spots. So just like be ready for it. That's why these coping skills are so important. And so practicing all of that beforehand is really great. But then I also have like journal prompts that I can give to people if they're open to it. And I really encourage like note taking between sessions too, so that if there is something that's coming up for them, then we're able to really discuss it in the next session. Because it's not like once we stop the eye movements, processing is done. And it's not like, they're still thinking about it after they walk out of my door. So knowing kind of where their head is at and what things they were thinking about between our sessions is super useful for us in our work together. So I would say journaling, and then the coping skill use is like some of the biggest stuff that I have people do between sessions.
And what are some of those coping skills you can sometimes recommend for people?
Yeah, so deep breathing is always my number one go-to. People love it or hate it, but I think it's the most beneficial. Different mindfulness practices, like grounding techniques. So the five senses, kind of going through the different senses and focusing on being present with where you're at, picking a color in the room and finding different objects just to help ground you. Different meditations people can listen to, and there's so many out there at this point that you don't have to listen to the same one ever if you didn't want to. But then there are some specific like EMDR coping skills as well. So like a calm place activity is something that we'll do, thinking of a place that makes them feel really calm and bringing the senses into it so that as they think about it when they're home, they're able to really like get there and just give their nervous system a bit of a break. And then there's another thing called a container exercise where it's imagining in your mind's eye some sort of container that you can put anything that's like distressing or disturbing into so that you can deal with it at a later time, but you can still walk through life without feeling like this is weighing heavy on you. So they take some practice, but again, that's why it's so important to try this stuff out before we actually get into the processing piece so that you're really solid for it. But of course, for other people too, it's like exercising or again, journaling can be a good one. Different rituals that people really enjoy, like simple as just like making a cup of coffee, but being really mindful about drinking it, or tea is another one, or certain snacks or meal prepping. Like there's so many
Hmm.
different interesting things that you can do where self-care or coping skills doesn't just have to be like getting your nails done and taking a deep breath.
Well, I always find walking my dog is like almost therapeutic because I love being outside and I almost force myself not to take my AirPods with me because I know if I do, I'll like get on my phone and I'll start working or I'll get on a call or something. But like just the other day I was like, no, distractions, no technology. And I was just walking the dog and just like, I don't know why that's, maybe you could tell me, Dylan, why do you feel like just going for a walk is so helpful or therapeutic for people?
Yeah. Again, like that grounding piece, I think is what it really comes down to and being focused and present. Because it is so easy to just throw your AirPods in and listen to a podcast or listen to music. But then you're physically somewhere, but then you're mentally somewhere else. So when you're able to have that like mind body connection and you're focused in one place, it can be so helpful. And nature is just such like, it's like the best way to reset.
Yeah,
So being out there and just like listening to the wind or hearing the birds or you know your dog walking or whatever it is just a nice way to recenter.
for sure. Okay, and then tell us next about DBT work and what DBT stands for and what that looks like.
Yeah. So DBT is dialectical behavioral therapy. This is not something that I do. I'm not trained in
Okay,
it.
okay.
I love referring people for DBT if they would be a good fit for it. So Matthew, we call the DBT king because he loves it. But it focuses a lot on like interpersonal communication and again, like mindfulness practices. It's great for so many different things, but borderline personality disorder is a big one that DBT is really used for, especially for the communication piece and working through relationships and just sort of like coming to accept life on life's terms. It's all about like distress tolerance. So life is not going to be easy. It's not always going to go the way that we want it to. What is it that we can do that is in our control to be able to handle it and still function really well and get through life and prosper as much as we can, even if we're not like the biggest fan of it. So it's incredibly useful for people to really learn and hone in on these skills because it can be quite structured, which a lot of people appreciate because sometimes therapy is a little bit more abstract and talking, where some therapists will use worksheets or DBT skill cards and things that they feel like, they kind of have homework that they
Cool,
can really
cool.
hone in on. Yeah.
Awesome, awesome. And I know you see a lot of couples at the practice as well. So tell us about the Gottman approach and, common patterns you're seeing in couples relationships and how that can help them break through.
Yeah. So Erica is our couples therapist. She loves working with couples for a variety of things, whether it's, sometimes it's even like premarital or when concerns come up. But honestly, a lot of the times, like if people are interested in couples therapy, we're kind of encouraging them to get to it before there's a problem. Of course, it's easier to do more prevention than reaction. So the Gottman lens really focuses on like different communication patterns and ways to improve things, trying to get out of critiquing the partner or being less defensive. There's something that's called like the horseman techniques. And so the John Gottman, who's the creator of the Gottman method, the Gottman lens, kind of walks through all of these different horsemen and the things that can be present in relationships that, can be really difficult. So she's able to help people work through some of those things. And it's when I think about couples therapy, like using things through the Gottman lens is kind of like that gold standard. If you're a therapist and you treat couples, you know who John Gottman is. So it's nice to have someone who understands all of that and that I'm able to send couples to if they need that.
Awesome. And I know virtual care, is becoming much more prevalent now. Obviously, with COVID, it was super convenient for Jasmine, and we were like, oh, we don't have to go anywhere. We can just jump on a therapy session online. So, what are you seeing, kind of, over the past 5 years, or anyone who's listening? Like, say whether it's a couple or an individual, and they want to come in for possibly in person or virtual. What are kind of the pros and cons of both? Or, do you sometimes recommend clients like, hey, listen, you can come in and see me, but virtual might be better for you? Like, what are some of the things clients are telling you or that you're seeing virtually or in person?
Yeah, with COVID, it was definitely majority of telehealth visits.
Yeah.
Everyone was
Yeah. Yeah.
so comfortable with doing virtual. It kind of made sense with the way that life was at the time. I still did some in-person sessions through COVID, which is a little wild, but it was nice to offer it. Um, but I would say now we're seeing like 95% of people want in-person sessions. So of course we'll always offer virtual, especially for convenience. Or sometimes, if someone is like frequently late to their sessions, we're like, it's okay.
Clients are never late, Dylan. Everyone's always on time to
Never.
their appointments.
If it becomes like a recurring thing, we're like, virtual is an option too. Let's talk about this.
Mm.
So that you can get the most out of your session. Because if you're 10, 15 minutes late, then that's time that you're losing out. So let's figure this out. So those virtual options are definitely really great. And like, we do see quite a few adolescents and college aged kids. And so if they're out of state and we're able to practice in that state, then we can keep them and they don't have to start over with someone new or take really long breaks. So that's awesome. The convenience factor of virtual is always there. In person, though, I love in person sessions because as a therapist, like, I'm watching someone and their entire body. And when I only see from here up, sometimes that can be a little bit tough in our therapy sessions because someone might be like really tapping their leg or their foot is going kind of crazy, but I can't see it. And that is like an indicator of anxiety. Or is there something that I said that made you nervous? Tell me about that. So being able to see people's like full body is really helpful for me.
Nice.
So I definitely prefer the in-person sessions, but the convenience is unmatched when it comes to virtual.
What percentage would you say now is virtual versus in person?
It's like very minimal for virtual. I'd say like
Okay.
5% probably.
Okay. Yeah.
And usually it's a distance factor. If there's
Cool.
someone who's living in Leesburg, they're usually here, unless
Sure, sure.
there's, something coming up or a family situation or like if with the perinatal mental health stuff, sometimes I'll see moms and their kids are napping, so we'll do a virtual session, but nice to have the flexibility to do both.
You mentioned earlier just kind of the huge rise of depression and anxiety that we're seeing. And so I always find it interesting. I see a lot of teachers. And so obviously through COVID, that was a huge change for the teachers, going virtual. And a lot of them have told me how horrible it was for the kids, not being in school in the classroom. But I'd love to get your, kind of take on it, Dylan, what you've seen with this huge increase in depression and anxiety, maybe just specifically for the younger generation, maybe the teens or the, young adults. What do you feel like are the biggest factors? Because I know obviously COVID was a factor, but then technology and social media is also a big factor. And then I always kind of am like, well, the parents, you can't let the parents off the hook. You have to, parenting has to play a role too. So I'd love to hear your opinion on it. And I'm sure it's multifaceted, but tell us kind of your theory on maybe why we've seen such an increase in depression and anxiety, especially in the younger generation.
Yeah, I think those three factors are pretty much it.
Really? Okay.
Yeah, if you hadn't said those before, I think those would have been the three that I said too. COVID, of course, being a huge piece of all of that, especially from a social anxiety perspective, and then people's sports not they weren't able to play their sports or they weren't able to walk across the stage and graduate and all those things that 20 years from now we might look back on and be like, oh, it was no big deal, but in the moment that was a huge deal for people and feeling so isolated and then stuck at home with family, which wasn't something anyone was really prepared for. And no matter how great your family is, you are going to butt heads when you've been stuck in the house together for that long. So that can be really hard. And I don't know if you or anyone who's listening has read The Anxious Generation, but that book is incredible.
I think Jasmine's reading it or she told me, maybe somebody told, I've heard of it.
Yes.
Have you read it? I'm
Yeah.
guessing yes.
Yeah. I would read it a million more
Okay.
times too, especially with like raising my own kids as they continue to get older. I'm like, there are so many things in here I have to remember. But it really just goes in to talk about, like, again, the use of technology and social media and some of the things that parents have done over the years and with the best of intentions, but there's room for improvement. So, one of the things that really stuck out to me was he talks about how stranger danger was so big, right? And
Right.
not letting kids play outside anymore or having your eyes on them constantly, like at all times. And that's a great parenting move, right? Like you want to make sure that your children are safe. But then he goes on to talk about having technology, and people have access to children so much more through technology with fake
Mm.
Instagram accounts or TikTok and whatever else is out there, Snapchat, like all different things that whether it's adults or other kids with bullying, anything like that, there's access to it is so much greater where it's less about stranger danger at this point. There's more harm coming from the phone. And when I read that, I was like, it's such a great point. And so he just goes on and talks about different like tips and things that people can do as parents to really try to help their children, and giving them more independence and things that can feel really scary and like out of the norm from what we're used to now. But when our parents were younger, it was so typical for them to walk to the playground by themselves at 6, 7, 8 years old, you know? And so it's like
Right, right.
it's finding that balance of what feels okay for you and your family, because some people aren't going to be okay with that, especially if it's, you don't have eyes at all on them. But trying some things out. I saw something on social media recently where this mom let her 5-year-old son go into Chick-fil-A and order everything himself. And she gave him money and everything. And the smile on his face when he came back to the car of like being so proud of himself for doing it on his own is a lot of what the anxious generation talks about, of like being able to give them the confidence to do stuff on their own without feeling like, oh, well, I need to have mom and dad there. I could talk about this book all day.
I love it. I
Yeah.
love the cliff notes you're giving me because now I can get more motivated to read it.
Yes.
So I like that you talked about confidence because I mean, even when I'm interviewing staff all the time, we're always hiring, we're always looking for people. The confidence is the first thing, like even on the phone, before I even have an in-person interview with them, I can just hear it on the phone. So does it talk about that in the book like that, that the parents' eyes always on the kid, is that inhibiting kids' confidence because mom's always there, dad's always there to, okay, you're on the playground, everything's safe, everything's fine. So kids, because they don't have that independence to, like you said, when I was a kid, mom was like, go ride your bike down the road and get away from me. Like my mom was like pushing us to get away, where
Yes.
now, it's like, where are you? Where are you? So, um,
Yeah. Yeah.
does that confidence factor, basically play a huge role?
He talks about like exactly what you're saying, that like lack of independence in a way seems to be affecting their confidence growing up, because when they're not alone and trying things out and failing and then
Mm.
doing better, or like figuring it out and problem solving, that is just squashed. And so giving them a little bit more independence, of course, in like an age appropriate way that feels okay for the parent. You're not going to let them drive a car when they're 6, but
Right,
go
right.
and walk into Chick-fil-A and order something. You might get some looks, but he really talks about like this is a societal issue. And if we can get more people on board, it won't be so weird to see like a young kid going and doing something. Their parents are right outside. We're not talking about them being gone, but close in proximity so that if something did happen, they're there, but not right behind them. And yeah, it's been pretty eye-opening to read. And the book itself can be pretty like academic heavy almost in the beginning, but then he gets into more stories and things, which I thought was really helpful. So it's a good balance.
Awesome. And so, with the clients that you're seeing in the office, do you feel COVID is still having an effect on people, even though we're 5 years, from COVID? Is that still something that comes up a lot in your office, or is it more the social media now, or the other things that are causing maybe the anxiety and the depression?
Yeah, I would say that COVID itself, it's not like we're talking about it as much, but I think the effects of COVID are um, kind of related to some of that social media use because what was everyone doing when they were home? Their
Right.
social media use was increased tenfold, I'm sure. So that's been a big part of it. And trying to talk to like my teenagers or even the younger kids too about doing more things socially and in person and like joining groups or being part of a team and putting themselves out there in ways that I think they aren't used to anymore or didn't really have that experience. I mean, when you think about it, 5 years, if someone was just going to kindergarten, now they're in fourth, fifth grade, they never really had a lot of that opportunity when they were super little to be part of a group or a team or something. And so now it just feels really scary. I think it's getting better the farther that
Yeah.
we get away from it, but it can be nerve wracking and have some anxiety around it. Again, trying to build up their confidence and work on those like social skills and things to help them move forward in that direction is kind of where we try to come from.
Do you also see it in adults, just kind of or do you give the recommendations to adults to like, hey, you need more community? Like we obviously at my office, I'm always trying to promote community because obviously everyone thrives for community or thrives in a community. But I've noticed since COVID, we used to do at least just one marketing event a month, and it wasn't always like marketing. It was more just like community building. It was just like, hey, we're going to do bowling night, we're going to do movie night. I actually, in COVID, it was most popular. Like we would rent out an entire movie theater, and everyone have their masks on. They could sit like socially distanced apart, and everyone loved it.
Yeah.
But what I've seen is like, obviously, people get back into their normal lives, and usually they're just too busy. But even with adults, do you see that there's a lack of community with adults in addition to younger generation?
Absolutely. Yeah. I think about some of the adults that I work with, and we're always trying to come up with, like, I don't know, can you go to the gym or could you join like a rec basketball league or literally anything just to get you out of the house and talking to other people because it's great if you have like your friends, but if your friends don't live in town, then what are you going to do? And with the perinatal population too, is such a big thing is trying to find community and people who are in similar stages of life as you so that you don't feel so alone. Some of our best friends are people that my husband met through his softball league. And if he hadn't done that, I don't know what we would have done.
Thank God for softball.
Yes, exactly. So that was like a great way to get started and begin to meet new people. And then, of course, with like work and trying to just get out there and do things. Because, like you said, community is so important for so many different reasons.
And I feel like even for me myself, like it needs to be like in person, like because we can jump on a podcast, we can jump on a Facebook group, but that's not like really community. I mean, obviously, if you're a perinatal mom and you need a group
Yeah.
to like ask questions and stuff, that's great. But like, I feel like people really thrive off the face to face.
Hmm.
So whenever we have a networking event or anything like that, I just always try, and it is hard because you have to find the time, you have to make the time to do it, and that's another big issue for adults too. We always can just use work as an excuse, or kids, or family as oh, I don't have time for that. I don't have time for friends, but it's like you have to have that because it is I feel like it's such a good social construct that everyone thrives for.
Yes, for sure. That in person is just so different. And I think there's something too about like the effort that each person is really then putting into being there because it is an extra step. But that's also a really great feeling that this person is taking that amount of time out of their day to really like be here and be focused and present. Because when you're on online, it can be so easy to be distracted and doing other things. And again, convenience is unmatched with it, but especially, in person is just so different and it's way better.
Awesome. Well, I wanted to kind of focus back on you, Dylan. Tell us, obviously you've got this amazing practice now. You've been thriving. You've got four other providers. What keeps you motivated, Dylan, when you're a business owner, you've got a team now, you've obviously, seeing clients throughout the week. What are some things that you do to kind of help you stay motivated when it's a difficult day or a long.
Yeah. It's a good question. I think something that really helps with my motivation is like sticking to routine. And so now that I've been doing this for 5 years, it feels somewhat easy where like I wake up in the morning and I know what my day is going to look like and I follow that same structure. I also really love working out and going to the gym. So I'm always making sure that I have time for that because if I have time for myself, then I have way more motivation throughout the day because I did something that I enjoyed and that I really wanted to do. And so that's helped me. The other thing too is I really try to reflect and be like, I'm this support person for so many other people, and I'm encouraging other people to challenge themselves and do hard things and work through the uncomfort. So I try to do the same thing too. If there's days where I'm like, oh, I don't want to go and do this thing, or I'm scared to go to this networking event alone, which is one that happens a lot. I'm like, I can do hard things and I can do something that's uncomfortable, and I'm going to push myself to do it because that's what I would tell my clients to do too. So I try to also live by my own advice.
And how I think sometimes as providers, we forget how much energy we are expending throughout the day. So, how do you kind of re energize? Because when you are, I mean, for me, people are always telling me about their aches and pains and, all these things. And my mentor in school was like, Keith, you have to be very careful with that because when you're, a healer or you're trying to help people, it can be very draining. So, do you often feel sometimes you're just like emotionally, drained energy wise from seeing clients all day?
I think some days are definitely heavier than others, but I feel like for the most part, my education and schooling did a really great job of preparing me for it. And I don't know if it was just because it was something that they had talked so much about and really drove home that I was like,
Yeah.
okay, I need to be ready for this to prevent burnout. And just like you're saying, I think anyone in like that health and wellness space, it can happen pretty easily if you're not careful about it. So, really trying to just like set aside time between clients is something that I try super hard to do so that I have a little bit of break time in between. I also, like at home, try to get up before the rest of my family so that I can have some of my own time to myself. With having little kids, I have to prioritize that. And then again, like working out is my own stress relief so that I'm able to just kind of like, okay, I've heard a bunch of stuff today. I'm just going to go. I'm going to be present. I'm going to move my body, work some of this stuff out, and then be able to come back and be better and also have the attention and the focus to give to each of my clients, because as you know, when you're seeing so many people in a day, you want to make sure that you're giving the best to each person. So,
For sure.
yeah.
I'm glad you brought up the quiet time because I think sometimes people forget that one. Everyone knows that they can eat better, they can exercise more, they can move more, they can have that discipline or that routine, like you were saying. But I think a lot of people oftentimes forget, like, you need almost to like carve out time for rest or like, self-reflection, like you were saying, because so many people forget that part. They're like, oh, I went to the gym or, I've been eating healthier, I've been going for walks, but it's like you almost need to carve out time where you can just like, turn your brain off or unwind or rest.
Right.
Why do you feel like that's so valuable?
I think it's just because then you're able to be alone. And it's different from like an isolating alone where you're like pushing people away, and this feels so much more productive. Like rest is
Right.
important, and I think a lot of people equate rest with being lazy, and there's such a difference. Like
Yeah.
everyone
Yeah.
needs rest. No one is able to like go, go, go 100% of the time. And it's just figuring out what that looks like for each person because, sometimes it is scrolling on your phone, but if it can really be 10, 15 minutes, it doesn't have to be a super long amount of time, but having some time to just be quiet and sit with your own thoughts, that can be uncomfortable for people too because they don't want to be. But that's incredibly important in moving throughout your day and being able to reflect on yourself and like what it is that you need. Because outside of rest, what else is it that you might need? Do you need more rest later in the day? Are you planning your like to-do list for the day? Are you feeling, I don't know, like you want to do something more socially engaging? I think it just helps to bring people down, slow people down, instead of that like go, go, go mentality, which we can get stuck in very easily.
Sure. What is, now that you've been in practice for 5 years, what's one piece of advice you would give to yourself at the very beginning of your career, now that you know what you know now?
The one that comes up for me is never say never because I still am in that mindset of I'm good here. This is where I'm going to stay. I've got my practice, I've got my people working for me. But then in the back of my head, I'm like, don't, um, don't do that. Don't hold yourself to this because you never know what's going to happen and there could be really great opportunities. And I would love to have told myself, like, just be open to everything. And in the end, I was. But I think if I was, who knows what maybe I missed? I don't know. But being open to different opportunities and things, I think is some of the best advice that I could have given myself.
I feel like there's a delicate balance between being content with where you're at in life, but also trying to get better, right? So, like, I'm very guilty myself of just being like, I need to push myself more. I need to do better. Like, I'm very hard on myself, which I feel like a lot of people are. But then I think, yeah, there's the other side of that sword where it's like, you want to be content with where you're at, but you don't want to be like too complacent because you want to continually grow in life and all those types of things. But this has been amazing, Dylan. If someone's listening, or say what's the biggest misconception people have about coming to your office, or why do they, when they call and say, hey, do you guys help with X, Y, or Z, what's the biggest hesitation people have with coming to get either therapy or mental health in your office?
I think people expect that it's going to be very formal and they picture what like Sigmund Freud did, where it was someone lying on the couch and it's tell me about your feelings. Like it is so not like that. My
Yeah.
practice is much more laid back. We try to make it as approachable for everybody. Of course, we're professionals, but I'm not coming in a suit every day. Like you're not going to get that side of me. If you're someone who likes humor, I'm going to use humor in our sessions. We're going to talk about what works for you, what doesn't. Of course, I'm going to push you. But I think a lot of people have this idea that therapy is going to be really scary, or even that like the therapist they're going to see is like 80 years old. Sometimes people picture like working with a therapist is like, oh, I'm going to go talk to someone's grandma, which is, sometimes that is the case and that works for people, but finding the best therapist for you is what's most important. So giving it a shot is what really matters. And then even if you meet with someone once or twice, or you have a phone consultation and you're just not loving the vibe, then, try someone else, because it doesn't just have to be like a one and done.
I'm glad you said that, Dylan, because that's what I hear a lot from people. If I say, well, hey, are you seeing a therapist? Are you talking about? And everyone's like, I can't find one I like. That's the biggest excuse I get. So give us like top three. Like, what are the top three things you need to look for in a therapist to know if it's going to be a good fit? Like, what's your recommendation to people listening that are possibly looking for a therapist? Like, what are some good things you want to, um, you know, during that initial consultation? What are some good things you want to see in your therapist to know if it's going to be a good fit for the client?
Yeah, I think just the way that they approach your questions. When I answer them, I'm talking kind of like how I am to you. I'm much more casual in my approach. Just the words that I use, like I said, I'm not so stuffy. So if someone wants someone
Mm-hmm.
who's like uber professional and that's not me and I'm not going to be a fit
Yeah,
for
yeah.
that person, and that's totally okay. I'm happy to like give names or help them with finding someone who is more of that fit. And then I think it's also important for people to have a list of questions ready to ask that therapist. It's kind of cliche, like when you're in a job interview, make sure you have some kind of question to ask back. But to make sure that it works the best, I think it can be super helpful, whether even if it's just as silly as like asking about where they're from or why they got into being a therapist. Having that like personal connection can really change things. And over time, as I've had my practice, in school they talk about don't talk about yourself at all. You're like a closed book. It's all about the client, which is super true. It is all about the client. And I think there's a bit of self disclosure that can be really helpful for people when they are choosing a therapist. Like I said, I lost my dad, and I have quite a few people who have sought me out because they've also lost a parent. And so it's not like I'm talking about that in my sessions, but we both know that I get where they're coming from the best way that someone else could understand. So yeah, I think just like asking about some of their history, whether it's more formal and like education or trainings that they have, or why they got into the field, or what does their ideal client look like something just to open it up so it doesn't feel like such a stuffy conversation too can be really helpful.
That's Yeah, you want to make it feel comfortable, right?
Yeah, especially with something like this because it can be so private.
Wonderful, Dylan. Well, what do you have any big or anything coming up in the near future? Any marketing events? Anything's going on in the office that people can kind of reach out and check you guys out?
Yeah, we've talked about doing an open house for a while now, and I really need to sit down and like actually figure out the date for that because it's been 5 years and I'm like, I should do this. So that will be to be determined. But I do run groups with Caroline O'Neill at the Body Birth Baby Center. And so we're supposed to have a first time moms group starting in just like a week or so. So that is an option for people if they're a first time mom and are looking to have some support and grow community. Of course, the Body Birth Baby Center is an incredible resource. And so I'm so happy to be able to be a part of that. Matthew also,
Jasmine,
yeah,
Jasmine, if you're listening, you need to sign up.
yes, please. We would love to have you.
Yeah, yeah. Yep, yep, yep.
Absolutely. And then Matthew ran a social skills group for boys ages 9 to 12 over the summer. And so we're exploring the option of continuing that into the fall time too, and to have it cut off right before the holidays so that it's accessible for people. But that was also super successful with getting kids out of the house and, working on their communication skills with other kids their age outside of just talking on the phone. So those
Cool.
those things should be coming.
Wonderful. And if someone is listening and they want to connect with you, what's the best way for them to kind of reach out to your office?
Yeah, great question. First is either through our website or email is best.
Okay.
I don't have a receptionist who works for us or anything like that. If you call us, you get one of the therapists. So calling us can be tricky because we do meet with clients all day. So emailing is best. And then that way we can schedule and coordinate a time to actually talk on the phone. Of course, we'll do those free consultations no matter what. And then you can sign or you can choose to go through with an intake after that and we can get you scheduled. Yeah.
Well, thank you so much for being on, Dylan. It's been a great conversation. And yeah, if anyone's listening, check out Dylan or any one of her other counselors at Beckner Counseling. And yeah, we really appreciate you being on. It was great.
Yeah, thanks so much for having me. This was fun.
Fun, Dylan. Have a great day. Thank you.
You too.